my name is Amanda, and I am a nurse practitioner student, and I'm going to be doing a physical assessment on you today, okay?
Okay.
So can you tell me a little bit about why you came to our office today?
Sure. I've been having pain around my umbilicus,
Okay.
epigastric pain, I think, and heartburn for about 3 weeks already. And I've noticed that when I eat spicy food, it makes it worse.
Okay, are you taking any over-the-counter medications to try to alleviate that pain?
I've tried Tums and Pepto.
Okay, and it's not...
Sometimes it helps for a little bit, but sometimes it doesn't.
Okay, any other symptoms that you're having?
I have difficulty sleeping.
Okay, and have you tried anything to help you sleep better?
I try to sit up after I eat for about 30 minutes. Just sit up and not lay down. And usually the sitting up kind of helps me.
Okay, alright, so now I'm going to begin my physical assessment, okay? I'm going to start with your head. I'm going to inspect your scalp, okay? So her head is upright, and there are no tremors. Her scalp moves freely. There's no tenderness, no lice. Her hair is smooth. There's no cracks in her hair. It's not dry. Her skull is normal shape and size. It is symmetrical. There's no lesions or trauma noted. Okay, so now I'm going to inspect your eyes, okay? Very good, and her eyes are equal, round, and reactive to light. Okay, I'm going to ask you to follow my finger, okay, without moving your head. Up, down, side, and back. Okay, and her visual fields of gaze are intact. Her pupils were equal, round, reactive to light. The 6 visual gaze fields are intact. There's no drainage, redness, swelling, puffiness noted to her eyes. So now I'm going to inspect the nose. Okay, so you may tilt your head back. I'm not really. Good. Very good. So the nose, the mucosa is deep pink, and there's hairs present in the vestibules. The nasal septum is close to the midline, and there's no perforation, bleeding, or crusting noted. Okay, I'm going to inspect your mouth. Can you smile for me? Okay, so everything's symmetrical. Her smile is symmetrical. It's pink. Oh, take that for me. Okay. Okay, so the mouth, the teeth and gums are clean. The mucous membranes are pinkish, smooth, and she has moist gums. There's no inflammation or bleeding noted. Her throat, she had a tonsillectomy, so the tonsils are no longer present. There's a little erythema noted to the back of her throat, and her gag response is intact. I'm going to palpate the lymph nodes. Okay, so they are non-palpable, non-tender lymph nodes. Her throat is midline, no masses, swelling, or tenderness noted. Now I'm going to look in her ears. Open back. Okay, so for her ears, there is minimal cerumen noted. There's no odor. It's pink in color. There's hairs in the outer canal. The tympanic membrane is translucent, a pearly gray with no perforations noted. So to test the hearing, we use the Weber and the Rhine test, but I don't have a tuning fork. So what you would do for the Rhine test is you would put the tuning fork on the mastoid, and then you would ask the patient to tell you when they can no longer hear the tone, and then do the same thing on top of the head. And air conduction should be twice as long as bone conduction. Okay, so now I'm going to inspect the chest. So we inspect, palpate, percuss, and then auscultate for a chest examination. We're going to look at her chest. It rises and expands equally and bilaterally. The anterior diameter is less than the lateral diameter. I'm going to palpate for her pulse now. Okay, her respirations are 16. They're easy, regular, no apparent distress is noted. And so now I'm going to percuss. Okay, and for percussion, the entire examination, you would do the posterior and then the left lateral, right lateral, and then anterior. Now I'm going to auscultate. So when we're auscultating, we're going to auscultate brachial, brachiovesicular, and vesicular. Your brachial sounds are going to be high-pitched and a high intensity. The bronchovesicular are more moderate pitched and a moderate intensity. And then your vesicular sounds are low pitched and lower intensity. Deep breath. Yeah. Okay, and her lung sounds are clear, no wheezing or rhonchi noted. Now I'm going to perform the cardiovascular exam. So we inspect the pericardium. We know that the apical pulse is located at the mid-clavicular line, the fifth intercostal space. So I'm going to auscultate. And there are no pulsations, heaves, or lifts noted. We would palpate the pericardium. You begin at the apex and you palpate the left sternal border as well as the base. And then you're going to auscultate. You listen to your aortic, pulmonic, tricuspid, and mitral sounds. For the aortic, the S2 is louder than the S1. For the pulmonic, the S2 is also louder than the S1. For tricuspid, S1 and S2 are equal. And on the mitral sound, the S1 is louder than the S2. We would also include a breast exam. You would begin with inspection. The skin texture should be smooth and the contour should be uninterrupted. The nipples and the areola should be round and oval and bilaterally symmetrical. The color may range from pink to black. The nipple should be everted with no retraction or deviation noted. The area should be smooth with no wrinkle or crusting noted. Okay, so now we're going to inspect the abdomen. So I'm going to ask you to lay down for me, please. Okay, so you would inspect the skin and the surface characteristics. You're going to note the venous flow above the umbilicus is going to be towards the heart, and below the umbilicus, the flow is away from the heart. Then you're going to auscultate. So I'm going to auscultate in all four quadrants. She has very hyperactive vowel sounds. There's no friction rub or breweries noted. Then we would percuss. So the way we would percuss is like this. And we note dullness over the solid organs and tympany over the intestines and stomach where there's air. And then palpation, we do light and deep palpation to check for masses, muscle spasms, fluid, and tenderness. And she has no masses, no tenderness, swelling, or fluid noted. Okay, so while I have the patient laying down, I would go ahead and perform the pelvic exam at this time. Okay, so what we would do first is we would inspect and look at the external skin. The labia majora the skin should be smooth and clean. There should be a good distribution of hair. No nits or lice are present. Then we would move to the internal exam. We would inspect the cervix for color. The color should be pink, and that color should be evenly distributed with a smooth surface. There should be no discharge or bleeding noted. There may be a little discomfort due to the exam, but there also should be no pain present. Okay, and then we would move on to the musculoskeletal. So I'm going to ask you to get down for me. Okay, and I'm going to inspect her ability to stand erect. I'm also going to make for sure that her body parts are symmetrical, that there's no lordosis, kyphosis, or scoliosis noted. So I would ask her to bend over, and we would just run our fingers down and check the spine. Okay, go ahead and stand up. So now I'm going to ask you to get back up here, and we're going to perform the range of motion. Okay, so can you squeeze my hands? Very good. Okay, now you're going to pull. Very good. And push up against me. Very good. Okay, and now with your feet. Okay, push. Very good. And push. There you go. And back here. Push. Very good. Okay. Okay. So the cranial nerves were assessed throughout the entire assessment, and that concludes my physical assessment.